Have made big strides in the fight against COVID-19, but there is still only one fully approved treatment, and research shows it's far from a breakthrough cure. ABC 10 News anchor Derek Stahl is going in depth to explain why it's so hard to develop an antiviral for COVID.
This week, Family Health Centers of San Diego started giving patients the latest authorized treatment for COVID-19, a new cocktail of manufactured antibodies from Eli Lilly. But outside of a few blends of antibodies like these that have an emergency authorization, there's only one fully approved antiviral that can fight the virus head on, remdesivir. Studies show remdesivir shortens illness time, but doesn't really improve survival rates. So there's a big push to develop a better, stronger antiviral. And UC San Diego's Dr. Davy Smith is helping lead the charge.
Our job is to find therapies for people with early COVID, so to prevent people from getting into the hospital. That's our whole job.
Dr. Smith is overseeing a series of worldwide trials for Operation Warp Speed to find the next big therapy for COVID. They're currently enrolling patients for trials on 5 different potential drugs and adding a 6th later this month.
We have about 100 and some odd sites. 137 sites, I think, now in the United States, and we have 30 sites internationally that are getting up and running.
He says developing an antiviral is a lot tougher than developing an antibiotic to fight bacteria. For one, bacteria are big living cells that are easier to target. Viruses, on the other hand, hijack our own human cells, so scientists have to worry about friendly fire. And secondly, viruses can mutate faster.
You would expect the virus to try to find a way to get around any drug that you use. And what we have to do as scientists in these clinical trials is to figure out maybe which drug causes less of that, or maybe use more than one drug.
They're currently testing new blends of antibodies, along with an inhalable drug and a pill that can interfere with the virus's ability to replicate. Scientists often do that by finding ways to add junk code to the virus's RNA, like installing malware on a computer to crash the system. But unlike some other viruses, SARS-CoV-2 has a tricky defense system. It essentially has a viral spell check.
This coronavirus has a proofreading mechanism. It can go back and said, aha, you tried to trick me and put that fake base in there. I'm going to take it out and put a regular one in.
Still, Dr. Smith says researchers have several promising therapies, and he expects new ones on the market this year. But he can't do it alone. They still need people to sign up for clinical trials. Derek Stahl, ABC 10 News.
For information on how you can volunteer to be part of the next COVID breakthrough, go to our website, 10news.com.